Hello everyone. This presentation is on Chuan Tiao, also called ligusticum powder to be taken with green tea. It is on the California Acupuncture Board herbal formula list. I will briefly review the traditional pattern, a hypothetical patient, 3 possible drug-herb interactions, and a practical management plan. The goal is to connect traditional Chinese herbology with modern medication safety in clear student language. Traditionally, Chuan Tiao belongs to the category Dispel Wind. A representative pattern is wind-cold headache with vertex, or temporal pain, and nasal congestion. Important ingredients include Chuan, Bai Jai, Qiang Huo, Zai Zin, Fang Feng, Bo He, Gan Kao, Jing Jai. In practice, the formula should be chosen by matching the full pattern, not simply by matching a biomedical diagnosis. I would also screen for red flags, confirm that urgent medical care is not being delayed, and review all medications, supplements, and over-the-counter products before recommending treatment. My hypothetical patient is 33-year-old woman with recurrent external type headaches and sinus pressure. The current medicines are ibuprofen as needed, aspirin 81 mg, hydrochlorothiazide. This case gives a possible reason to consider Chuan Tiao, but it also creates interaction questions. I would document tongue and pulse findings that support the pattern, confirm the diagnosis, and ask about kidney or liver disease, bleeding history, pregnancy status when relevant, and prior reactions to herbs or supplements. Medication reconciliation is essential because many clinically important interactions come from the combined physiologic effect of herbs and pharmaceuticals. Interaction 1 is Chuan plus aspirin or ibuprofen. The mechanism is that Chuan may have antiplatelet and vasodilatory effects, which can add to bleeding risk with antiplatelet or NSAID therapy. The clinical significance is low to moderate, but more important with frequent NSAID use or easy bruising. My management plan is ask about bleeding history and use the shortest effective course. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 2 is Gan Kao plus hydrochlorothiazide. The mechanism is that licorice can promote potassium loss and may raise blood pressure. The clinical significance is moderate in patients already taking potassium-wasting diuretics. My management plan is monitor potassium and blood pressure, avoid chronic unsupervised use. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. Interaction 3 is Bo He plus oral medicines. The mechanism is that peppermint can alter gastrointestinal comfort and motility, which may affect tolerance or timing of oral medicines. The clinical significance is usually low. My management plan is, if needed, separate the herbal dose from key oral drugs by 1 to 2 hours. I would explain to the patient that evidence quality varies across herbs, formulations, and studies. For that reason, I prefer conservative dosing, a reputable product, and close attention to symptoms and objective monitoring when appropriate. In conclusion, Chuan Tiao may be reasonable when the patient truly matches the pattern wind-cold headache with vertex, or temporal pain, and nasal congestion. The safety question is not whether herbs are simply safe or unsafe. Risk depends on the specific ingredients, the product quality, the dose, the treatment duration, the patient's organ function, and the medicines being taken. I would start conservatively, monitor the most relevant objective values, and communicate with the patient's physician and pharmacist. This presentation is educational and does not replace individualized medical care. Thank you.